order. This morning, the Finance Committee is here to discuss the health care proposals in the President's fiscal year 2015 budget. Secretary Sebelius, thank you very much for joining us this morning. This discussion will undoubtedly trigger debate about the Affordable Care Act. Certainly, there are going to be reasonable differences of opinion, and what I'd like to do is start with a handful of overlooked facts that are not in dispute about what has happened since the Affordable Care Act became law. First, with the passage of the law, health care in America finally is no longer just for the healthy and the wealthy. Before the law was enacted, insurance companies could discriminate against Americans with a pre-existing condition. That meant those who were healthy had nothing to worry about. Those who were well off could pay their bills, and everybody else went to bed worried that they could be wiped out financially. Second, the rate of growth in Medicare is slowing. The fact is that according to the Department of Health and Human Services and their data, annual Medicare spending per senior grew by 1.9% over a 2-year period, slower than overall economic growth and much slower than historic growth. Over the past 3 decades, per senior spending grew 2.7 percentage points faster than the economy. So the fact that the rate of growth in Medicare is slowing has the potential to be great news for seniors who want lower premiums and for taxpayers who want to extend the life of Medicare without breaking the bank. Third, there are several important reforms that have been launched over the past few weeks. For example, building on work members of this committee have done, thank you, Senator Grassley, on this point, to open the Medicare database to Americans. The Obama administration yesterday made public unparalleled amounts of information that's going to help our people make choices about their health care. This is also going to help fight fraud, promote competition for Medicare services, and be a useful tool for the private sector. This information can be used by private employers and others to bring down the cost of insurance. Another recent and promising announcement helps provide patients with life-threatening illnesses with more choices for their care. For the first time, patients will have access to hospice care without having to give up the prospect of curative treatment. This puts patients and families first, and it is high time. Fourth, the Congress now has a bipartisan, bicameral plan for dealing with chronic disease. And thank you, Senator Isaacson, for your work on this, and we appreciate the input of Senator Bennett and Senator Warner. This legislation focuses on improving care for older people with multiple chronic conditions. This is the fastest growing part of the Medicare population, and those older people deserve better and more affordable care. Fifth, there's plenty of debate about which Americans enrolled in the Affordable Care Act and when, but the independent data shows that the number of insured Americans is significantly lower than it has been in years. For example, a Gallup poll released this week shows that the rate of uninsured Americans fell to the lowest level since 2008. And finally, the Congress has made real progress on permanent repeal of the broken and dysfunctional Medicare physician payment formula. The reforms agreed to would push Medicare to be driven by the quality and the value of care. Today's volume-driven system isn't good for seniors, it isn't good for their doctors, and it isn't good for Medicare. The President's budget proposal endorses a bipartisan, bicameral reform package, and we look forward to working with you, Secretary Sebelius, to get this done, get it over the finish line by the end of this year. Madam Secretary, in wrapping up, the last time you were here, Chairman Baucus, of course, chaired that hearing. I compared the rollout of the Affordable Care Act to the expansion of Medicare to provide prescription drugs to America's seniors during the Bush administration. And I focused on the bipartisanship that took place then and the need for it to be repeated. And obviously, the Medicare prescription drug benefit, like the Affordable Care Act, zeroed in on the key concerns: expanding coverage, financial assistance to the needy, and increasing marketplace choices. The reality is that Medicare Part D has been an enormous success. For millions of seniors, it's been a godsend. It's cost less, 30% less, than the Congressional Budget Office predicted. But we all know it had a pretty bumpy start, and many of the news stories from those early days of Part D resemble the kind of news stories that we've seen with the Affordable Care Act. The Congress did work in a bipartisan way across the aisle, regardless of how a member voted on Part D, and the program was able to get off the ground and become the success it is today. And like the Medicare drug benefit, millions of Americans now have the economic security of health insurance they didn't have just a few years ago. And regardless of politics or feelings about this law, that is something that's good for the economy and good for our country. I'm going to turn to Senator Hatch here in just a quick second. I didn't want to tell colleagues we've got this vote at 10:30, and it's the intention of Senator Hatch and I to just keep this going. We will have senators coming in and out and just go in order of appearance back and forth. But I wanted colleagues to know, given the interest in this subject and its importance today, we're just going to keep this going. Senator Hatch, we welcome your comments. Again, express our thanks to Secretary Sebelius for being with us. Senator Hatch.
Thank you, Mr.